we will talk about the steps of the study startup process and the roles and responsibilities of each team member. We'll look at critical elements that have to be included in a successful study execution to make sure that we are kicking off appropriately with that site. We'll look at the use and efficacy of different types of tools and training that we can engage our sites with. And we'll also discuss how to establish ongoing measures and techniques for having a relationship with those sites that helps foster a sense of compliance as well as communication throughout the study. So first, we're going to look at some of the steps of the study startup process and the roles and responsibilities of each team member when it comes to site initiation visits. So the objectives of a site initiation visit are to really ensure that all sites are appropriately trained and prepared to start the study. We know it is a regulatory requirement from an FDA perspective as well as other regulatory bodies that sponsors provide investigators with all the information they need to properly conduct the study. And this doesn't just mean making sure that they have case report forms and all the templates and tools that they need. We have to make sure that we're providing them with the information in terms of the comprehension of how to use those tools. So CRAs are really in a position where they're acting as the liaison between the sponsor and the site for really being the conduit of making sure that the sponsor is relaying that information. When we meet with those sites, we might have done a pre-qualification assessment or a visit up front, and that gives us an opportunity to gauge the engagement of the site, the facilities and equipment, the staff. We always want to see who's going to be working on our study. We have to assess their qualifications and training as well. Part of meeting that regulatory obligation of selecting a qualified investigator is making sure that they have the resources to also support the conduct and the oversight and the control of that study through its duration and to be able to complete it so that we are not in a position where we might have to terminate that investigator's involvement. And we want to ensure that we are clearly defining the study expectations, not just from our perspective, from a sponsor perspective, but from a regulatory perspective as well. What are the requirements to have a well-run and controlled study? And keeping in mind as we talk about this, we are all looking for really the same thing, whether it is us as sponsors or as auditors or as regulatory authorities. Our product in clinical research is making sure that we get good data from protected subjects. So a site initiation visit is an opportunity to lay that groundwork and make sure that that investigator not only has all the tools they need from us and the information they need from us as sponsors, but also from, or CROs, if that is your task, but also to make sure that they internally have the processes and the resources and the support to make sure that they can meet you halfway to get that good data from protected subjects. The site initiation visits. We know that a representative from the sponsor or CRO will typically visit the site before it starts to provide a thorough training and perform initial investigational product accountability. So sometimes when you show up for those site initiation visits, your product is already there. Maybe it hasn't been opened. Maybe you ship it as you're going. Sometimes it comes shortly after you are there. So even if that investigational product is not there, which we would hope it would be, you can assess the facility and the equipment, who's going to have access to that investigational product, and who is going to actually control that so that you know how it's going to be used. We have to make sure that all study site personnel are familiar with the details and requirements of the study and that they are in a position to be able to fulfill and help you fulfill your obligation to provide that thorough training to the site. So that site initiation visit gives us an opportunity to train, but we can only train people if they're available to us and if they are actively engaged in that training. And we'll talk more about that in a moment. And then we're also going to look at the roles and responsibilities of the coordinator and the monitor in relation to study initiation visits. And as we talk through this, we want to keep in mind that the investigator needs to be actively involved in these site initiation visits as well. As you will see, there's a lot of focus on how that coordinator and that monitor interact, but it is the investigator that needs to be actively involved to make sure that everyone who's going to be on that study is there and trained and available and responsible and aware of their responsibilities.